We have a patient coming in today with a pretty heavily ingrown nail. So the patient actually has ingrown nails on both sides. We've already numbed the patient. You can kind of see these little poke holes. So we've already cleaned the toe really well, and we're gonna get right to it. So the first thing we do is we put our toe tourniquet or tourniquet on. Now that the patient's been numb, we're gonna test it, make sure. Okay, no pain, great. All right, so that lets us know we're ready to proceed. So as you know, we take our freer elevator and we're gonna use this to elevate the skin from the nail. Any pain?
No.
Great. We're working our way all the way down to the root of the nail. And we're taking very small movements, and we're just letting the instrument do the work. And once you're all the way through, you'll actually feel a little bit of a plunge or a give, which tells you that you're all the way through. So there's that little give, okay? So now we go to the other side, and we're gonna do the exact same thing. So we are hugging the nail, staying right under the skin so that we're not tearing or cutting into the actual skin itself. We feel the freer or the instrument kind of give, which tells us we're all the way through. So once we've achieved that, now we come in with the thin side of the freer. And we're gonna repeat the same process, but we're gonna go underneath the toe. So we're gonna go underneath the nail plate in between the nail bed. Now the other side. So you get right underneath the corner of the nail, and that one was really ingrown. And we just work all the way down. Okay, so once that's done, now we come in with our other instrument, which we call an English anvil or a nail splitter, because that's what it looks like. It's got two different ends. One is a flat end, as you can see, and we're gonna allow that flat end to kind of guide us in cutting the excess portion of the nail all the way back. So that's that satisfying sound that we hear of the nail splitting. We clean our instrument off, and then we go to the other side and we do the same process. So we allow the instrument to kind of guide us straight back, all the way back. There you go. So once that's done, this is the most satisfying part of the procedure, and that's where we see exactly what comes out. So we come in with our hemostat, we make sure that our hemostat is clamped down all the way back, and we're gonna turn it away from the nail fold, and that's gonna allow for us to remove the entire nail that was digging into the skin. So you take one full turn, and you pull out. That's one.
Jeez.
That's right. It's a big one. And that is full turn away from the nail fold. And that's two. The one on the lateral side wasn't nearly as big on the one on the medial side, which makes sense because that's the one that was bothering him the most.